Sleep. Some people do it more than others, and some people do it better than others. But regardless of who you are, no one is exempt from having to sleep. On this episode of Stark Naked Radio, Dr. Alice, Amir, and I go over what's happening in the world of sleep supplements, give a brief reminder of why sleep is important, and offer some practical tips for how to improve your sleep immediately.
Hey guys, this is Morgan, and today's episode is brought to you by Stark, located in Irvine and Newport, California. If you enjoy the podcast, subscribe and give us a 5-star rating in iTunes, and don't forget to share it.
Stark Naked Radio from Southern California, where we talk about
strategy,
butts,
goals, blood chemistry,
lifestyle,
IV therapy,
poop,
tips, digestion,
and science to help you
look better naked
and perform at your best.
What's up, everybody? This is Stark Naked Radio. I'm Tyler Mounts with
Amir Mofidi.
and Dr. Alice Wynn.
It's the usual crew. We've been back after some time, and we're kind of bringing up a subject that we talk about a lot indirectly, but now we're going to address it more extensively because we haven't had a show exclusively on sleep in a while. So if you guys have listened at all, you know that sleep comes up pretty regularly in our normal shows, regardless of what we're talking about. But we're going to talk about sleep in its entirety today, particularly because of some new regulations, Dr. Alice, from my understanding, from the FDA around certain ingredients that have kind of thrown a wrinkle in our usual sleep supplement regimens that we take. Can you fill us in a little bit on what's going on with that?
Yeah, it's phenibut, in fact, that the FDA has decided to not allow to be provided over the counter or actually in supplement form either, even prescribed by a doctor or a physician. So it's unfortunate. I've had a lot of patients who've told me that this was a sleep supplement that allowed them to go to sleep without feeling really groggy in the morning. But it is what it is. Maybe it'll come back into circulation in the future. Maybe it won't. It is banned in, I believe, Australia. So you definitely can't, have access to that in that country. So, it is what it is. So we've been experimenting with a lot of other things. But, let's just kind of recap on the basics.
Yeah, so we're going to do things a little backwards to what we normally. We're going to start off with some of the nerdy supplement stuff, and then we're going to go into some of the more lifestyle, habit-related stuff on sleep. So, like Dr. Alice mentioned, phenibut, is that how you say it? Phenibut is an ingredient that unfortunately was in most of our most awesome sleep supplement products.
Cavanase.
And according to Todd, he hasn't slept since we ran out of Cavanase. But in all seriousness, there's two things. Is for one, sleep supplements are not a cure-all. Like, you can't just take sleep supplements with really, really poor lifestyle and really, really poor sleep hygiene and routines and habits and expect to get quality, restful sleep. But also, too, without the sleep supplements, it's been interesting because we've started to experiment with some new things. So, Dr. Alice, if you could share with us a little bit about what phenibut did for us, and kind of what the alternatives are that we're kind of experimenting with now in terms of help with, because obviously melatonin is still a product that we have access to, but it's not as effective or doesn't work as well for everyone.
It depends. And the issue with sleep is that everyone has a different problem or a different presentation of it. So I tend to like to have patients to, buy the Oura ring, for example. So it's OURA, because that's going to tell us if you're having issues with REM sleep, deep sleep, any of that sorts. And yeah, we just have to basically see, unless we actually don't have any quantitative, objective data, then we're just kind of throwing things at a wall and hoping that it'll stick. So at least with phenibut, or what was found in Cavanase, that we're looking at the GABA receptors in the brain working, being able to activate it. So GABA receptors in the brain are responsible for you being calm and also partially putting you back to sleep or putting you to sleep. if there is an issue there, then again, it could be genetic, it could be a deficiency, it could be a lot of things. Then that's why Cavanase has been so effective previously. Now, it could be other things as well, but we'll kind of get into those baseline supplements later on. But that's essentially how phenibut works. It just binds to those GABA receptors in the brain, allows you to just, shut off, just relax, go to sleep. Now, other things will also bind to the GABA receptors. For example, progesterone will actually bind. That's why women who...
Yeah, but if I can't just take progesterone.
Well, there are some practitioners that will give men progesterone, to which I'm like, I don't know about that. But menopausal women, whenever they get close to menopause, that's one of the first things that they'll complain about is, in fact, a sleep disturbance. It's because their progesterone levels are declining during that period.
So can you offset some of that? Like, let's say we had access to phenibut.
Yes.
Could you offset some of the issues that a menopausal woman would have with sleep by supplementing with other things that bind to the GABA receptors?
Progesterone. Just giving them straight up.
No, but I mean like phenibut. Like if you gave someone that product.
So that's actually part of the Flash Ease formula.
Oh, it is.
Yeah. Cavanase actually had a Flash Ease formula that included phenibut and I believe black cohosh to help with the kind of like fluctuations in the hormones and the hot flashes and all that stuff. Hence the name Flash Ease. But since they have pulled it from the market, even that product is not available.
Huh, crazy. So what's some of the stuff that we're experimenting with to replace the phenibut products?
Well, first of all, we did try a few formulations here and there through a different company that was able to provide the raw material for, sleep. Things that, botanically speaking, we knew would work. Unfortunately, both formulas, we actually had two test formulas. They didn't work.
No, they did not.
No, they did not. They did not. Although now we're hopefully bringing something in where they're bringing other botanicals like lavender, skullcap, California poppy seed. So those are all things that will help with sleep. So we're using another company, experimenting it. I think it's Designs for Health. They do have a product called Myosedate. So we're going to try that on you, in fact, and maybe a few other people to see if it works. But other than that, I'm a naturopath, but the problem is that some of these botanicals, they're just not strong enough. And, I'm not sure why that's happening with this population. Maybe our population is much more stressed out than the typical population. We do have larger men, so maybe the dosages need to be higher, although I haven't really experimented with that. We've actually had to go into the world of peptides. Mm-hmm. So peptides, two in particular. There's one that is called the Delta Sleep-Inducing Peptide, so that's DSIP. That one we've experimented with Todd, and he has an Aura Ring. That, in fact, is the only thing that we have seen so far to increase his deep sleep. So, and this is shown in the Aura Ring. So that has been really, really fascinating. We've tried everything with Todd, like every single thing, and it hasn't touched it. Now, if a person had issues with REM sleep, like me, there is another peptide that's called CJC epimorelin.
Oh, that's my favorite.
Oh, that one is, in fact, one of the growth hormone releasing peptides. And that's fascinating in itself because, again, growth hormone is really involved with the regulation of sleep.
I hear people who actually go on HGH can sleep like 9-10 hours.
Yeah, it's quite fascinating. So the issue with going on GH in itself, by the way, there are problems with it. Number one, insanely difficult to get as a practitioner. If I try to prescribe GH, like the FDA will flag me. They will flag my license, and they will basically watch me like a hawk for forever, pretty much. Now, supplementing or at least prescribing GH right off the bat is going to affect your pituitary function. So it's going to shut it down. It's kind of like giving testosterone to a person. It's exogenous testosterone. It's going to shut down their own production of testosterone. So that's a big problem if you give straight up growth hormone to a person. Now, if you were to give one of the peptides, it doesn't actually affect pituitary function. So it actually allows for a more natural release of the of growth hormone in the body. Now, what have we seen with that? Yeah, we have seen an increase in REM sleep. Now, another thing that we also evaluate is heart rate variability, HRV. And both DSIP and so far with CJC ipamorelin, we are seeing an increase in HRV as well. So
You have to inject these peptides, right?
yes, so
How often do you have to do them?
it depends. The CJC ipamorelin is typically 5 days on, 2 days off. The delta sleep inducing peptides, it's like 2 weeks straight to see how things go. Is there resistance eventually tolerant? Like, will you develop tolerance to it? Yeah, potentially. That's why you want to do 5 days on, 2 days off for the ipamorelin CJC. Whereas the DSIP, that one I have seen, at least from other colleagues, they say that can also be used indefinitely with maybe a week off here and there. But these peptides are very fascinating. It's something that is newer. It has been, I was first exposed to a few of the peptides about 10 years ago. My previous mentor was really big on a few of the peptides. But these newer ones that are coming out, it's pretty interesting.
What type of practitioners are using peptides?
So you need, first of all, do not buy peptides on the internet. Just
This is like those sketchy steroids Amir used to buy
yes.
from Mexico.
From China. So I went to a presentation where they were talking about how there were a ton of contaminants found in some of these online peptide retailers. A lot of them coming from China, some of them coming from God knows where else. But the laboratories, pictures of the laboratories where they were developed, not great, not very sanitary. On top of it, yes, contaminants. There were some issues with some people, again, buying it off the internet, having some toxicity issues, and they were able to trace it back to these online peptides. So I do go with some trusted peptide companies. The bigger one here in the States is TaylorMade, and they're pretty.
Golf company?
Yeah, I was going to say they make golf clubs and peptides.
and
Wow.
peptides.
Very, very versatile company.
Anyway, so that's that. That's.
But how do you? Like, these have to be injected. Can you just go and buy them? Can anyone buy these? Can you go to TaylorMade, or do you have to get them through?
No, you have to get through. TaylorMade will only sell it to practitioners.
Okay, so you have to.
Okay.
But that was my question. What kind of practitioners? Anyone?
So usually doctors, NDs, MDs, DOs. I'm not sure if nurse practitioners or registered nurses can order them. I haven't asked, but yes, they do ask for all of my kind of doctor credentials in order to prescribe some of these peptides to patients.
Gotcha.
But yes, since it's an injectable, that's again, anything that's an injectable,
You get it in an EpiPen.
No, you do not want an EpiPen. But again, it's a growth hormone releasing peptide. At least the CJC ipamorelin is. So you're going to get a ton of benefits from it: anti-aging, repair, mood, all sorts of things. So it's fascinating. I'm just kind of. There are some practitioners who have used this for over a decade, and they've seen some really great results from the peptide therapy.
So stuff changing in legislation, stuff changing just in the landscape and the stuff available to us for health and fitness. So we're constantly trying to keep up with it. Dr. Alice is great about helping us stay ahead of the curve with all this these changing things in our field. So that's kind of an update on the sleep supplement protocol. But I wanted to take a minute and Doc and Amir, you can jump in with some stuff. Let's go back to why sleep is so important in the first place. Because there are a lot of people, despite how much we talk about it, that still think if I get 5 hours of sleep, that's enough. I'm functioning okay. But can we talk a little bit about what actually goes on when you're asleep, the different systems of the body that are affected by sleep deprivation, and kind of maybe scare people back into focusing on their sleep hygiene again?
Yeah.
Amir?
What? I'm sorry, I fell asleep.
So let's talk. Let's go body comp first, and then we'll go health second.
Well, I mean, just in the sheer numbers of it, if you live to be 80 years old, the worldwide average life expectancy is 72 years, 71 and a half. You're going to spend a majority of that time sleeping. Mm-hmm. Even if you I try to skeet out of it, like I'm going to do 5 hours, I'm good. But if you look at generally, you're going to be spending a great deal of time sleeping. So it's biologically wired in to be vital to our existence. Animals do it, babies do it. As you get older in age and kind of get in your senior years, you wind up doing it more and more often. It is wired into our physiology and our biology to sleep. Now, some people don't care about survival and fitness or like their general health. They're more concerned about what they look like right now, what they feel like right now. Is particularly in the Western world, and when you brought up body comp. So any body composition goal is enhanced with adequate sleep. Research has shown this time and time again when people try to gain muscle mass, if they're sleeping properly, they gain muscle mass. If they're not, they gain body fat. Same thing on the opposite side. When they try to lose body fat, when they're sleeping improperly, they lose more lean mass of their total weight that they lost. They still lose weight, but they lost lean mass. Versus the ones who sleep adequately, they lose fat mass as the predominant weight that they lose, and they are able to maintain or lose very little marginal amounts of lean mass.
Yeah, I think there was a study, an older study where they had two groups and for both groups, the caloric intake was controlled.
Correct.
Like controlled caloric deficit for two groups,
Yeah.
but one group, the only difference being, so same diet plan basically, but one group slept 8.5 hours a night, the other group slept 5.5 hours a night. And the group that slept 8.5 hours per night lost, so roughly 6 pounds of total mass lost in both groups, right?
Yep.
So they're again, same caloric deficit. Those the other variables were controlled, so total mass was the same because of just
the calories are the same. Yeah.
It's energy balance, right? The difference being is that the group that slept 8.5 hours of the and we don't know macronutrient. I don't know macronutrient.
I think protein. I think with protein was matched, but other than that, it was variable.
So yeah, and was it like do we know if it was optimal? Was it probably wasn't right? It was probably lower than we would generally recommend, but. 8.5 hours a night sleep, they lost 3 pounds of fat mass, 3 pounds of lean mass. So I mean, we can probably guess they weren't getting as much protein as we would like.
And that's a horrible ratio.
Yeah, that's a horrible ratio. But what's even worse is the group that slept 5.5 hours a night lost 1.3 pounds of fat mass on average and 5 pounds of lean mass.
Right.
Same caloric deficit, same total mass loss. The difference is a much larger percentage came from lean tissue when you don't sleep enough.
There was another great study that was a little bit more reflective of how the average person goes about it these days, where they do catch-up sleep, where they'll sleep 5 or 5.5 hours Monday through Friday or Monday through Thursday, and then they'll do bolus hours on the weekends, like they'll get more sleep, like catch-up sleep, and they showed it didn't work. So even
didn't work in the terms of body comp.
So the control group was at 6.5, so not even 8, right? So like 6.5, and the other group was like 5 and then 9, right? So kind of like the net sleep over across the week was kept kind of similar. I don't remember the numbers up, but it was the net across the week was the same. One group did it staggered, where like low sleep, high sleep, and the other group was stable across the week. The stable group lost body fat, minimized lean mass losses. The other group, the catch-up group, was the one with kind of a hodgepodge of lean mass and fat mass. So even if it's vanity that it is the driving mechanism, you're still good. Sleep is still important. And then if you extend that to health and sports performance, athletes are always napping. You have
coaches are always napping.
Oh man, if that was an Olympic sport. But we have these every goal that you have in mind, sleep is a big part of it.
Yeah.
Regardless of if it's vanity or something more health related.
Yeah. So let's talk about some of the health effects of sleep deprivation. Doc?
Well, I mean, right off the bat, what's interesting to see with at least the CJC ipamorelin is that fat loss is a nice side effect of these peptides. So I mean, when you're in deep sleep, that's actually where you generate the most of your testosterone. So this is something that I see over and over again is these sleep deprived CEOs, or just, I guess, any person who would walk
Anybody,
into,
right? Yeah.
my office will have low T. Women, men, doesn't matter. What's even more disturbing is that even for some of these men, we're going to see low estrogen as well. Now that is a health risk in its own. You're going to have issues with heart health, bone health, brain health with low estrogen. And a lot of people talk about high estrogen in men. I honestly see more low estrogen in this population, so more low estradiol. Interestingly enough, with the DSIP, the delta sleep-inducing peptide, whenever patients go on this peptide, their testosterone comes up. It actually increases your LH secretion from your pituitary, which will then increase your testosterone production from your testes. The other thing is, yes, I've heard from a few patients, it's whenever they go on the CJC or any sort of the growth hormone-releasing peptides, they get more vascular. They get leaner. Sleep is so important. I will,
Well, so another important hormone is so you're talking about sex hormones, but
Yes.
when you think of endocrine function in general, cortisol is associated with a lack of sleep. In most non-depression related instances of insomnia, chronic insomnia, occur in people with elevated cortisol levels.
At night. Yes.
And so the people who, and cortisol is obviously a hormone, and so when you talk about just the whole endocrine system, right? Like upregulation of a hormone that's not supposed to be produced chronically in large amounts is going to have downstream effects on other hormones like your sex hormones, like thyroid, like even things like vitamin D, right? Like technically vitamin D in terms of how it functions is an anabolic.
Yes.
Is a steroid, right?
Yeah, it's considered a steroid.
And so anyways, it's pretty widespread. And then on top of that, you increase production of a hormone that's catabolic. And so you start to break down tissue that you shouldn't, one of which is brain tissue, right? Like
yes, excessive amounts.
You can break down brain tissue as a result of increased chronic hypercortisol production, which is associated with sleep deprivation. So not sleeping, you can actually start to lose brain mass, which is crazy. And then on top of that, because you're producing so much more of this one hormone, you start to see deficiencies in the other hormones as well.
Yeah, potentially.
So there's all kinds of things that can happen.
Then you have to ask the question, like, why is that cortisol high in the first place at night? And for our population, it's either their life, their job, their family, their friends, their dog. Something is going to basically impede upon that. So we can throw a bunch of supplements all day long to the patient, but if they don't address that root cause, they're always going to have a problem. So again, the way that I approach it with patients is that you have one of two choices. You can keep going down this path of death and destruction. You can learn to...
You say it to them just like that?
Yeah, pretty much. You can learn to deal with it in a better way. And this, again, through exercise. Sure, that's great. That's one way. Meditation, self-care, any of those things. Or you have to consider what we docs call the ectomies. So an ectomy means the removal of that trigger. Now, I leave that up to the patient to decide. Is this a job ectomy, a spouse ectomy, a girlfriend ectomy? I'm sorry, you can't get rid of your kids, but maybe, I don't know. But yes, at the end of the day, you have to address that trigger one way or another.
Yeah. Well, in some cases, it's a bit of a hen and egg thing because sleep deprivation can cause more cortisol production, and more cortisol production can cause more sleep deprivation. So you can get into this vicious cycle where it's goes. And again, you got to create an intervention somewhere in that cycle.
Yes, you do. And again, we, at least on my side, I'm not going to jump to the peptides right off the bat.
Yeah.
Peptides, in my opinion, is considered like a mid-range intervention. So again, we go with the basics. Certain basic supplements, magnesium, certain botanicals, sure, B6, taurine, any of those. Bedtime rituals, shutting down at the end of the night.
Yeah.
And if that doesn't
let's-
work, then
Let's talk. Let's finish. I want to go because again, we have there's the people out there that are quick to jump to the peptides and the pills and the potions and forget the habits and routines. And so I want to go into that in a little bit more depth. But I do want to finish up on.
Yeah, what we want to do. This is kind of like bridging the gap between the next thing. What we want to do is get someone into the parasympathetic state. So that'll. This is like for that person who's like, okay, I need something to do quick. It's like it's not going to be quick, but we need to get you into from the sympathetic state, the fight or flight, which people are in low grade versions of it all day long, punctuated with higher spurts of it. Like someone sends you a text message, they expect that's the only text message you got that day. So why haven't you responded in 0.3 seconds? And we want to shift you into the feed and breed, rest and digest, parasympathetic nervous system. And that'll require peace of mind and peace of body. So not taking caffeine at 8 p.m., not watching Rambo 3, but peace of mind and peace of body. So peace of body first, because peace of mind is going to be a really fun one, but peace of body could take a lot of different forms. Have you been dieting for an extended period of time? Mm-hmm. If you have, sleep will start to get disturbed. If not right away, eventually. Are you over-exercising? Right? Or are you exercising very, very close to the allotted bedtime? Mm-hmm. Like I have a 7 p.m. training that goes from 7 to 8:30, and then I'm trying to shut it down at 9:30. So it takes a little bit more work on my part to wind everything down so I can get peace of body. Are you eating too far from bedtime, or are you eating too close to bedtime? That's a lot of variability. So some people will eat close to bedtime and they're out, like they love it, like the carb backloading kind of people. There's people who eat close to bedtime and they can't sleep because they feel full, they feel overly full. So that's a little variable. But we want to like the people who do stretching, they do joint circles, like cars as we call it here at Stark. Those are all ways of creating peace of body, warm baths, stuff like that. You can really go in any direction, but if you keep it the fundamental as I need to create peace of body to get this thing going, you're working in the right direction. Like having the right bed. Like some people are sleeping in uncomfortable beds or uncomfortable pillows.
Yeah, crazy.
Uncomfortable beds, uncomfortable pillows. Like the temperature in the room, the lighting in the room or lack thereof, more specifically. These are all ways of creating peace of body, physiologically speaking.
Yeah. So, and quick anecdotal one. We moved. So our old place was in Tustin. It's a lot warmer because you're further from the water. So we had one of those in-room AC units. We ran it pretty much every night just to keep the temperature controlled, to keep it cool, because it means California never gets that cold. And so it's dark room, cool room. We moved closer to the water. It's a lot cooler. So we were just kind of having like the temperature just at the, with the breeze from the ocean, all that stuff is like ambient temperature. It was really, really nice. Recently, being summer, it's gotten warmer. So we had like the fan in the window, and because the fan's in the window, the curtains are a little more open, a little bit of lights coming in. I started not sleeping well. I'm like, this sucks. So we order one of the portable AC units. Just they have got like those big. They look like R2D2, right? Yeah. And they hook it right up to the window. They're first of all best investment of your life. They're like $300, and they cost nothing to run. And your room's like the Arctic. It's amazing. But so, anyways, we got that literally. Timing is serendipitous, right? We got it yesterday. I hooked it up last night. Plug it in, close the window, set the temperature. It's pitch black in my room again. Room's cool, and I slept like a freaking baby. Like it was just instantaneous.
Oh, very nice.
And so
that's a peace of body.
Peace of body, exactly.
Right. And then what the biggest trouble we're going to find, most of our listeners are going to find, is peace of mind. Mm-hmm. Because people are just running around worried about shit all the time. I got to do this tomorrow. You're not going to solve world peace tonight. Some people, new mothers, they got to be up and alert for their children. That's fine. Mm-hmm. But most people aren't staying up at night thinking about this kid in Vietnam with leukemia. It's very like, what do I got to do today? What like the things I got to do today, or I did this well today, or I didn't do this well today. This is due, that's due, or just you name it. I'm not saying they're not valid concerns. These are valid concerns that people can that people have to wrestle with. But the timing of it is one, and the efficacy of it. Like nothing's going to happen.
Yeah.
Like you're not going to wake up at 2 a.m. and write the great American novel.
Yeah.
Like, I don't know what to do with my life. It's not going to solve it.
This is an important thing too, because I think what we're going to move into this idea of what we call sleep hygiene.
Yeah.
Which is kind of the habits, routines, lifestyle choices you make around sleep. There's a really important point, because this kind of stuff, now that we're getting into, becomes very, very subjective in terms of what does or doesn't work for each person.
Correct.
You know, like there's like calories, eating too many calories, eating more calories than you burn and losing weight. That's a universal. Like that's not going to work. It doesn't matter. Like it's like, oh no, but that's your truth, not my truth. Like there's like eating too many calories and getting fat is everyone's truth, right?
Correct.
The sleep thing's different, because like for some people, take your to-do list for tomorrow. Like for some people, taking in their head, thinking about all the stuff they got to do tomorrow, and writing it down gets it out of their head and onto paper, and they can let it go and relax. Yeah, for some people, they write it down. They're like, oh shit, tomorrow is going to be so stressful. And then they get worked up, you know? So like what works for one person doesn't work for another person. And even to your point about that, like we had Gundry on, I don't know, a couple weeks ago. And he said one of like the common things is like, one of his main things was don't eat too close to bed. And then we had Jade Tita like a few weeks before that. And he goes, one of the best things is to eat really like right before bed.
Right.
And so you're just like, well, who the hell's right? And so again, to your point, like for some people, one might work well, one might not work well.
And what we're trying to do is create peace of mind.
Yep.
So if you're marching forward with the idea of I need to create peace of body, okay, do whatever's working for you. And if you don't know what it is, try stuff.
Yes.
And same thing on the peace of mind stuff. Like if meditation just drives you, like you can't do it or like you need to start breathing, just breathe, or you need to write, or you need to journal. Like, you need to read, and like what are you reading? Like I read nonfiction, and it doesn't work. I read fiction or like a rom-com or whatever, like that works. Like certain things will trigger certain sort of responses in everyone a little bit differently. It all kind of comes back to what we were kind of built by, like as a kid.
Yeah.
Like if mom like read you stories as a kid and helped lull you to sleep, that might be something that you want to bring back. If you were like, if you loved doodling as a kid or in high school or whatever, like maybe doodling or just kind of jotting down your thoughts, doesn't even have to be like what I'm going to do tomorrow. You just be like, oh man,
brain dump.
Brain dump. Like, what do you think? Why is brushing teeth so weird? It's like you just start putting stuff on paper, and it helps kind of relax you to sleep. And we're all trying to just create peace of mind and peace of body, because you can't have one without the other.
Well, and it's funny. Like, do you remember when we talked to Dr. Michael Bruce a while back?
Yeah.
And he is talking about. He's talking about. He said, he goes, people get freaking bent around the axle on stuff like blue light. He's like, people are like freaking out, like, oh, I think I just caught a ray of blue light. Meanwhile, like they're like stressed out about everything. It's like if you're gonna get a little blue light from the back from your Kindle, but like you take 20 minutes to read and unwind and decompress, like which one's the lesser of two evils? Yeah. And so, again, a lot of times we can get into this point where we kind of forsake the good, better, best, mentality in terms of like
in September, at the end of September last year, 2018, I started doing marijuana to help me sleep because I had poor sleep, and it worked. In January, the end of January, I ceased it cold turkey, and I've been having the best sleep since, let's say, May, June, until now. Like better sleep now than I did then, but. Because then I was trying to create peace of mind, peace of body through this artificial means. Mm-hmm. I mean, it's not artificial like a drug per se, like Ambien or whatever, but it was still this exogenous thing to bring me peace of mind, peace of body, versus getting it from an endogenous. Like I need to cultivate that on my own, which is what I've been consciously doing, especially like if I get home at 8:30 and I'm kind of wild up. Maybe I had a little caffeine to get me trained because it's at the end of a long day, to create that peace of mind and then get to settle down into the peace of body. The sleep has been better, or even at least the same or better than it was when I was doing some of the marijuana.
Well, and then also too, there's something to be said about like, is it the actual thing, or is it the ritual of doing the thing that creates the benefit? Because we talked to Christine Hansen, who is the sleep consultant. She's based out of Belgium.
Right.
We talked to her a long time ago, and she's kind of like one of those people that like you call when you're at the end of your rope. You're like, I've tried everything. I can't sleep. And I remember her saying, she goes, what I do is the first thing is I make them create a bedtime routine. She goes, I give zero input as to what needs to be in the routine. They just have to have one, and they have to stick to it 100%. And so when you think about, like, my big thing is sleep tea. I've got this one tea that I like. I swear by it. I think the tea actually works to help me sleep, but I don't actually know if it's, and I mean, I've tried other sleep teas and this one seems better, so it's not like I'm just making this up. But the reality of it is whether it's the compounds in the tea or the fact that I sit down and relax and drink tea that is actually giving me the sleep benefit is kind of like, I guess who really cares? But the point is that there's something to be said about ritual and routine.
Yeah, the body likes ritual.
Our brain, our body, it craves these rhythms. Like you said, and it ties into what you said, the people who sleep 6.5 hours a night, but they get it every night versus the binge sleepers are going to do better. And so anyway, so this idea of a routine is, I think, a really powerful, and the idea being that, like, let's say your routine is, and for women, washing your face, that's like this freaking tribal ritual, right? Like, you've got these 17 different products that you use, and it's like,
Alice is shaking her head.
I'm like,
sorry, I don't do the
looks
nighttime routine.
Rachel's like, okay, I'm gonna go wash my face, and I'm like, okay, I'm gonna like work for an hour and a half, but there's all these different things you can do, and like that can be your own part of your bedtime routine is like washing your face, right? Like, you take off your makeup, you use your spritzers and things, but and then maybe you shower, maybe you lay out your clothes for the next day. Mm-hmm. Maybe you make some tea. Like, so let's say theoretically your bedtime routine is you make tea, you relax, you lay out your clothes for the next day, you wash your face, you brush your teeth, you read for 10 minutes, you go to bed. And you do that over and over and over and over and over again, day in and day out. Eventually what happens is your brain gets conditioned to the point where as soon as you push the button on the tea kettle to warm it up, your brain goes into this.
It's Pavlovian response, right?
Yeah. Now, it's like the peace of mind starts not, it starts when you push the button for the kettle because your brain knows, okay, now we're headed into shutdown mode.
Well, yeah, it's the same thing. I mean, you're taking advantage of you're leveraging your neurotransmitters versus someone looks at a chocolate on TV and all of a sudden they start producing insulin. they start drooling. So you start to leverage the routine. I would advise somebody to find the routine that could be done legitimately anywhere in the world.
Yeah.
So that, like, if I'm crossing a time zone, it'll be harder to create peace of body, but I can still create peace of mind or start to get that cascade going. Like, if I'm out of pocket, like, oh, I don't have my stuff, I don't have my thing, I'm not at home base, and so you start to ramp yourself up again. So if I have a book that I'm reading, got to take that book with you.
Yeah.
Or a book with you. And if you don't, every airport around the world has a book as a newspaper book. So you get Tom Clancy's World War IV epic, and you start reading it. If it's your makeup and stuff, or like you're washing your face, most women will take that stuff with them, and you'll have to pay for extra luggage at the airport to facilitate it.
3-ounce containers.
But it shouldn't be so esoteric where it can only be done at home.
Yeah.
And that's really important, especially for our traveling executives and athletes and young people who just like to be out of pocket. Like their bedtime routine should be adaptable.
Yep.
That's why the Headspaces app is very good. Like, peace of mind is not separate from peace of spirit and peace of behind the mind. Peace of brain a peace of brain, but the peace of mind, like getting really clear and being comfortable with not being in control, really.
Yeah.
Because a lot of this anxiety and the stress of like wanting to stay up and do stuff is like it's a false exertion of control that people think that they have over everything. They don't have it.
Yeah.
Like adding, taking away 1 hour of sleep to like think about your to-do list won't make that to-do list any shorter, or add 1 month to your lifespan.
Yeah.
Or knock off 1% off of your body fat, as the research indicates, right? So getting into a Headspace app or just tapping into whatever you need to tap into, and that can travel with you wherever you are, right? And being able to relinquish control and be like, okay, what's going on? You know, how am I responding to all the thoughts that I've got? Because we don't have to stop the thoughts, but controlling and training our responses to those thoughts. Whereas my thought could have been anxiety, it's now more, okay, cool.
Yeah, which is easier said than done, obviously, right? Like,
Yeah,
this is a pretty long journey for most people if they do make that shift.
Yeah,
but
pushing the sled is hard. Mm-hmm. Pushing the sled, it can be like it's like the easier said than done. Like that's where it is. If a World War II pilot said on the radio once that the more slack or more resistance he gets, the more he knows he's over his target. If he's not getting any resistance, he's back at the battleship. Mm-hmm. But the more resistance he gets, the more difficulty it is, he knows he's closer to his target. He knows he's like right there. Mm-hmm. So if it's like, oh man, that sounds really hard, that's where it needs to be. Like, oh man, controlling calories, that sounds really hard to lose body fat. That's where we need to be. Getting more protein, that sounds crazy. That's where we need to be. Creating a bedtime routine, that sounds so much work. That's where we need to be. Mm-hmm. You just gave it away. If it's like, oh, super easy, I can do that tonight. Yeah, it'll probably be like peptide for some people. Like, oh, I just shoot the thing and I'm there. It's like, no, that's not going to provide the long-term solution of your problems.
Yeah,
in my opinion.
So that's kind of the tie-in is we talk a lot about these supplements and these, what did you say, mid-level interventions or whatever. But the baseline interventions is the sleep hygiene, is the routines.
Yeah.
So let's go through and share some of our favorite sleep hygiene components.
Doctor, ladies first.
Ladies first.
Right off the bat, I don't wash my face at night. I'm sorry. I'm one of those weird, gross women.
I was gonna say something.
Yeah.
There's this weird growth.
Yeah. So that's why that explains the blackheads.
I'm sorry.
Just kidding. Alice has
sister
magnificent skin.
My sister is an esthetician. She yells at me about this all the time. No, I just can't be bothered with washing my skin twice, a day.
Skin.
I do it in the morning, and that's, I don't. So
yeah,
anyway.
but everyone listening, she's Asian, so
no. Hey, listen.
What they say is Asian.
If you're a cracker, you may need to watch your face. So.
I am. Going to go against a lot of the things that we tell a lot of people to not do. I actually are. I am on my phone at night, and I have the night shift on.
Interesting. Okay.
Yeah,
but
I've got night shift on.
I got night shift on, so I don't have that weird blue light coming through. But I enjoy reading case studies at night. And that's
Michael Bruce's point is like he would say that what you get from the reading case studies and learning, and there's relaxation, there's benefit that comes with that, and the blue light you may take on pales in comparison to what you get from that. Yeah. And that's where people get too sensationalistic about like, oh, blue light's like, screw it. Like,
I mean, I think there is definitely a negative effect from blue light for sure. I am not discounting that. But, that's just how my mind has been wired for a very long time. Now, right before I go to sleep, I do put on some meditation. That is something, usually I will fall asleep. According to my ring, it will say about 5 to 10 minutes. That's where I'll fall asleep, and that's how long my meditations are. And I say this to patients all the time. If this helps you with sleep, if it puts you to sleep, I don't mind. Mm-hmm. You don't have to be completely present and cognizant the entire time you're doing a meditation. But, that's every single night, and that's been like that for probably the past 5 years.
So reading case studies on your phone.
Yes.
And
meditation.
Amir, what do you got?
Well, first of all, I make sure I'm in bed and not on the couch. I'm in bed, the lights are off.
Yeah, some people, I knew the people who like every night would fall asleep on the couch.
That's weird.
And wake up an hour later and get into bed.
And I don't freak out about waking up and going to the bathroom if I have to do that once in a night. But this might not apply to certain people. That's okay. You asked me my
yeah.
sleep hygiene, and this has been the most dramatic thing for my sleep, which is I love listening to and talking to God. I don't care how long it takes. I'm not even really aware of it, but if there's something on my mind or something I read earlier that I want to kind of unpack, I tap into that and I contemplate. I don't really petition very much, but I just kind of just connect, and sooner rather than later, I'm waking up and ready to take on the morning. It's nothing sexy, that's for sure. But if you could bottle it, it would fly off the shelves. Like it's legitimately what I do, and it's awesome.
Well, it's good, and part of the reason for sharing all of ours is they're all going to be different, and I want everyone to understand that that's okay. It's just
I don't care.
Again, like you said, you have to figure out the routine that works for you. Because for me, I spend quiet time, like devotional time in the morning, because I'm the most alert and present, and I want to be focused in that. And I find that it's like the opposite for me when I do it in the evening. Like in the evening, I'm more distracted. I don't get, and so
I'll do it in the morning too, though. But
yeah, but my point is, like, for one, it can be like, that's like the Grateful Journal.
Right.
Is another one. And people talk about the Grateful Journal as being this great thing. Like, some people do it in the morning, other people do it in the evening, other people do it both. And so again, the routine, because you can program through routine things on the upswing and on the downswing, right? Like
I said, like 4 or 5, or like the end of last year, I was doing weed.
Yeah.
So the routine can change.
Yeah.
It's okay to change. I mean, but like you'll still want to be creating peace of mind, peace of body. Tyler, what's yours?
So I've mentioned it a bunch of times. Tea. I love the tea thing. Like, for one, hang out with Rachel. We get quality time, right? Because sometimes that's the only time we get. Lately, because of the whole sleep supplement situation, I've been adding poppy extract to my tea. Mm-hmm. It's a botanical, Alice mentioned, that helps with sleep a little bit. So I've been liking that as well. So it's kind of like a supplement blended, layered in, like folded into a routine. Lately, the routine can change. I've been playing my guitar more.
That's awesome.
So I've been a musician my whole life. We moved a couple months ago. Only just got my guitar out recently.
How does that affect Rachel's sleep?
I'd like to think it's good. Strangely, Rachel's had this cortisol spike in the evening. It's like a screeching sound. No, so playing my guitar sometimes, and then reading. I've been reading, and specifically, I'm reading an autobiography, which is I generally read like different types of books. Like, reading basically has been kind of like the cap to my nighttime routine. So I do some things, and then reading is an actual paper book. I'm old school, and
well, you can write in those.
Yeah, you can.
And I love the fact of like writing or making notes or underlining stuff.
But to be fair, you can do that with a Kindle now too. But
I mean, you can, but
I know you're old fashioned too. You but there's no fountain ink. Like, there's no feather pens.
if I wanna pass it down to my kid, they can read it, or someone else can read it, and they can say, "Oh, this is what Dad or Amir thought." When
you
he
can do
got
the same thing. You can do the same thing with Kindle.
Yeah, but
kids can look at your Kindle. Pass your Kindle down.
In 10 years.
Will there even be books in 10 years?
Yeah, I think they've lasted a couple million years. They'll last for at least another 10 years.
There'll always be the traditionalists, like the people that like the sentiment of the paper. But so reading has been. It's funny. I don't read much more than a few pages every night. And sometimes I get discouraged. Like, I'm like, I don't really read that much. Like, I want to like, I hear about these people that crush like a book a week, and I'm like, I'm never, like, so what I do is I end up saying, well, screw it, and then I just don't read it all. And so what I've noticed now is, like, building the consistency of at least reading 10, 15 minutes a night, I get through more books. But also, too, I find that towards the tail end of my reading, I'm, like, dozing off anyways. And so then you just close the book, you lean over, and I'm asleep, like, lights out.
So kind of bring it, like, sleep is really important.
Sleep's important.
For all goals, even if you don't have a goal, it's important because it's wired into you to sleep, so you should do it well. You want to create peace of mind, piece of body. The forms that takes will vary quite a bit between person to person.
Yep.
And like we're not trying to influence you on like you got to do this tea, you got to pray, you got to meditate, you got to not wash your face, you got to wash your face. Like you need to create both.
Yeah.
And it'll take some time, and it might seem difficult at the beginning, but that's the point. That's how we're going to know it's going to be effective. It's because there is some resistance there.
And I'd like to throw this out there too, because the circadian rhythm involves both the up and the down in the cycle.
Yes, I was going to talk about that.
Evening routine / sleep can be enhanced by your morning routine.
Yeah,
Like,
and
if you have both,
and
if
vice
you have
versa.
both in place.
So in your sleep routine will help enhance your daytime, like your productivity, your go-getterness, whatever you're after, whatever that's keeping you up at night, like chilling out over it and being able to rest and digest and kind of wash your brain and kind of recover will allow for more productivity in the daytime, which will allow for more restfulness at nighttime, and you kind of get back into a nice rhythm versus being just a cortisol monkey all day.
Just a banshee.
Just a screaming banshee.
Cortisol banshee. All right. Thanks, everyone, for joining us. It's good to rehash the sleep topic. Thanks, Doc, for updating us on what's going on in the sleep supplement world. We'll be hopefully having some sweet botanical products in the next couple weeks to a month. And we'll see you next time.
Bye.
Bye.
Hey guys, thanks for listening. If you're looking for more content, be sure to visit our website and social media, both at Stark.Life.us.